So I want you to think about the last month of your life, or if the last month is a little irregular, then think about a typical month in your life. And not the one that is the middle of the summer, and that where you're vacationing, just a typical month besides the vacation one, or a typical week. And I want you to think, so on a scale from 1 to 10, so 1 would be pure bliss, just feeling free and peaceful. 10 would be psychotic. Your head wants to explode. High anxiety. If you were, and I know this is also the truth that it's a roller coaster, right? You're up, you're down, you're up, you're down, you're up, you're down. Feels like, emotionally, stress-wise. But if you were to give yourself an average, what number would you put on there? So put a number on there that feels like an appropriate average for you. Now, this next one, I want you to put your pens down, or pencils, put them down. I want you to find your pulse, either here or here, and I'm going to ask you to count them. So when I say start, just start counting each beat as it comes, and when I say stop, that's it. Ready? You got one? Everyone should have a pulse. Go. Stop. Okay, in your mind, double that number and write down the doubled number. So if you counted 30, write down 60. Right? Now, put your pens back down. Now, I want you to sit in your chair so your back is mostly straight up and down. Okay? Now, I want you to put one hand right here, one hand over your belly button. So one up in your upper torso, one on your belly button. Now, without changing anything that you're doing, I want you to notice as you naturally inhale and exhale, which hand moves more. As you breathe normally and naturally, which hand moves more? Is it your stomach hand, where this is moving in and out? Is it your chest hand, where it's kind of going like this? And don't worry, it's not a, this isn't a, don't worry about right or wrong. Just notice, or maybe it's both, right? Maybe it's, you notice your stomach's moving out, your chest is moving also. So on your paper, once you figure it out, write stomach, chest, or both on the page. So yeah, one of those three. Stomach, chest, or both. Okay, now the next one we're going to do, I want you to sit back up again. Just sit comfortably. And you can either do it this way or just, but I want you to, and you can do this with your eyes open or closed, doesn't matter, but we're going to count your breaths. And I'm going to ask you to, I'll say start, and just inhale and exhale is 1. Inhale and exhale is 2. And we'll do that for a minute. Got it? So just natural breaths. Don't try and be all cool like, I'm going to breathe 3 times. Just to show them. Okay. So, everyone ready? Just breathe normal, natural, but count your inhale and exhale. Ready, set, go. Yawns don't count. Stop. Okay. Count. Write down how many you counted. That was a full minute. Didn't that feel good to just breathe? Do nothing but breathe. Okay. Now you can go back to sitting however other way you were sitting. So we're going to go through each of these symptoms, and in each case, I'm going to ask you, we're going to talk just a little bit about each one so that we know exactly what we're referring to here. So in each case, there is a symptom, and then you will put a check on the line where it fits, where it says almost every day, all day, 2 to 3 times a day, once a day, 2 to 3 times a month, once a month, or never. So anger and hostility, meaning like road rage, lashing out at people emotionally, verbally. Anxiety. What's another way of, when I say anxiety, what comes to your mind? Okay, that's a good one, yeah. Worry, just kind of nervous of what's upcoming. Yes? So, and just put a mark on that, for that line. Boredom. Again, I mean, that's not a hard one to understand. Brain fog. So, brain fog meaning you just can't remember stuff. Now, I'm older and I just don't remember stuff, but sometimes it's stress related. Clenched jaw. So this is especially at night. Does everyone know does anyone have that at night where they wake up and their jaw is just tighter and tight? Is it? What's the name of that?
Well, you're thinking TMJ.
Bruxism.
Oh, no.
Right, or TMJ. Yeah, either of those. Where it just hurts, right? And you find yourself as you're sitting there going. Depression. Now, what I would like you to do on that line is, if you've been recently diagnosed clinically, I'd like you just to put 2 things with that over on the right side. If you've been diagnosed recently, and what medication you're taking for that. Difficulty concentrating. In other words, unable to keep your focus on a single thing at a time. Fatigue. And that doesn't mean you just worked out and so you're pooped. That's a different fatigue than 5 in the afternoon and you're just gassed and you haven't really done anything that is physically demanding, but you're still pooped. Grinding teeth. So this is a little bit different than the clenched jaw. Is that bruxism? And TMJ is the one you were thinking of, the tight. Headaches. Now, on the headache line, I'd like you to do the same thing as you did with depression. If you're taking any kind of medication for headaches, whether it's prescribed or not, if you're just, you're doing Tylenol every day, should never do every day. Now, and the other thing I'd like you to include there is, if on the headache line somewhere, just if it's migraines, include that there. Migraines aren't always caused by stress, and stress does make migraines worse. But there's not Whereas most of the other kinds of headaches, it's almost one-to-one. That's one of the closest one-to-one. Stress results in a headache, but not migraines. Okay, irritability. Muscle pain. And this is not the kind of muscle pain that is the just worked out 2 days ago muscle pain. First time on the hill on my bike muscle pain. This is the muscle pain where you're just, for no explicable reason, your muscles just hurt, which becomes fibromyalgia down the road. Overwhelmed, so that emotion of just too many things, not enough time. Panic. Restlessness. That's where you just can't sit still. Do you ever see people? I got to tell you the story. There's so many good stories. I was at this group of women and they asked me to come speak to them. I do a lot of those. And there was a lady, we taught how to meditate. It was just a very simple, one method we'll learn in here. And there was this lady, she was sitting like this, and you see people their foot's going like this, right? And you don't think anything of it, no big deal. And we did this meditation, and I'm not exaggerating for effect at all. This is exactly what she did, because it was so profound, and the people around her noticed the same thing. We'd gotten finished, and we were just kind of getting back to sitting normally, and she went, "Oh my gosh, I have never sat like this, and my foot isn't moving." And the people around her went, "We haven't ever seen," because it's so obvious, right? I can't do it very well because my legs are too fat. But it was just funny to see. She was just startled. I can't believe because it's just one of those nervous twitches that's how the body is trying to do something about its stress by moving, which is part of the fight or flight response, which we'll get into. Your body wants to move when you're in the stress mode. And if you're sitting there, it's going to do things that'll try to help you out. And that's one of those. Isn't that interesting? So cool. Sickness, flu, and colds. So we talked about the immune system. Do you get sick a lot? Sore neck and back. How are you with that one? Stress eating. And we'll get into these a little more deeply. Today is just kind of see where we are. But we're going to explain why all of these happen so that we can make sense. Oh, here's why I eat when I'm stressed. Or here's why I can't eat when I'm stressed. Tense muscles. So if you push in on your shoulders right here and it hurts, that's just that's a muscle that is chronically tightened up. Okay? Ulcers, or anything close to that. That's usually a further down the road problem. Okay, now these last few. Just check if this applies to you. It takes me longer than 20 minutes to fall asleep. Check that if it applies to you. I awaken one or more times during an average night. Besides if you have a baby. That's why one of the reasons I was asking if any of you have babies, because I have a daughter who just had a baby last week. And the first 2 nights were fine. The next night, all night long. They came over to our house on Sunday, and they both looked like, we're not getting any sleep at all. That's the difference, staying up all night or being awakened, than the stress kind of waking up. If I awaken during the night, it takes me longer than a few minutes to fall back asleep. The next one, I experience insomnia 1 or more times during the average month. In other words, it's impossible for me to get to sleep no matter what I try. I experience nightmares or night terrors during a typical month. I think there's a relationship between nightmares and stress. Not one-to-one, but there's a relationship. I grind my teeth one or more times, so we did that already. When I awaken in the morning, I frequently feel hardly rested or exhausted. Does that make sense how I said that, how I worded that? I don't feel, it's like I'm not going to kick the day when I wake up. I'd rather just stay in bed. I take medications to help me fall asleep. We're going to spend probably 2 days talking about the problem, and the rest of the semester, the solution. But it's really funny when you recognize the problem, it solves half of it. And that sounds strange, but once you understand how stress really works, you'll immediately feel like you have some control over it. And that's what we're going to be doing Thursday and next Tuesday. Okay?